This morning on Community Forum on WETS-FM, we are speaking with Dr. Trishul Reddy, who is with the Family Medicine Department of the Quillen College of Medicine at East Tennessee State University. And I think the reason you're here this morning is to talk about primary care, high-value primary.
Primary care is where people generally first bring their symptoms and health concerns and have their first encounter with healthcare system. Now, it's based on 4 core values of family medicine. 1, we treat you as a whole person. It's whole person oriented as they exist in their family or community. We create ongoing, continuous partnership between the patients and their physicians. It's not just one time you come and we treat you and that's no. We are there since you're born until you die. We have a partnership with you. We concentrate on preventative care, and we promote good health in the community. Primary care provides a medical home where team-based care addresses a large majority of personal health care needs in a comprehensive manner. Jim, it's nothing but a modern-day version of a good old family doc.
Yeah, which is now becoming kind of rare, and we're having people like you try to point out, let's go back to that kind of holistic care.
Yes, Jim. And one primary care physician, one family medicine doc, generates income benefits in the local community, about $1 million in a year. In state of Tennessee, we generate economic benefits of $1.7 billion per year. And most primary care physicians work in the rural areas, where health services are often one of the biggest, if not the biggest, employer. So in the next election, when health and jobs are going to be the number one issue, and I think primary care physicians are going to be leading the debate on this.
It sounds like in several different ways, both in the medical community and in the general society of America, you're just saying there's not enough emphasis on primary care, and also there's not enough people going into it, because in the medical community it's seen as slightly less important, even though, as you pointed out, Sanjay Gupta and other people that are on TV, these are specialists, but when they ask them about medicine on TV, they're always talking about primary care. Yes. And I had not really thought of that. Dr. Gupta used to be in Newsweek magazine, and that was one of the few times a person like me would see any medical advice. And you're the first one that pointed out he's not talking about specialized surgical techniques in there. He's talking about general things that will help people across many different levels of income and society. So it's like they're illustrating with their actions that this is important, even though they may say to their colleagues, oh, that's not specialized, you won't make as much money.
Exactly.
So tell us, now you have pointed out to me that there's a decrease in interest for students to join primary care, and as we've said, the medical community's in part kind of driving that. But what do you think we can do now that you've been to Congress, had your video aired, and shadowed a congressman who is a doctor? What can we do to increase the interest for students in primary care?
We at East Tennessee State University, especially the work of Dr. Fred Tuttiware, Dr. Blackwilder, Dr. Robin Firebrand, Dr. John Franco, Bruce Bernard, Forrest Lang, all these physicians we're trying really hard to create an interest in primary care, especially with the students. What we realized is that, as a first and second year medical student, their opinion about primary care is very high. But as they go through their training and when they come to third and fourth, it kind of drops. So students realize that the primary care physicians are the lowest paid physicians. Many medical students see that they can earn $3 to $4 million more during a career in a specialty than a career in primary care.
Yeah. Oh, more.
Yeah,
wow.
More. Yeah, yeah. So they already have a lot of loans. An average I believe is $250,000 when they come out, and so they want to go into a field where it's more feasible for them. We need to even out the pay among physicians. I'm not saying like we should all be evenly paid, or specialized fields do.
They deserve to be.
They need credit for doing all the training that they deserve.
But you're saying the disparity is just huge.
Yeah, the disparity is huge, and
that is huge. Yeah. $3 to $4 million difference over a career.
Yeah, and we primary care physicians, we promote health. We help with preventative care, and a lot of these background things that we do. For example, team-based care. If a patient comes, I call the nursing home. I speak to the social worker. We don't get reimbursed based on the current RVU system, right? Relative value unit system that we have right now.
Okay.
So if I write an email to the patient saying, "Listen, your labs are like this," we need to get reimbursed for these things, and that will help primary care physicians to adapt a patient-centered home. Basically, I urge all medical students right now that are going through medical field that come join our family medicine interest group. We have Dr. Blackwelder and Dr. Holt have created a family medicine interest group where we talk about the importance of primary care.
Yeah. This morning on WETS Community Forum, we're speaking with Dr. Trishul Reddy, who has been talking to us about primary care. He's in the Family Medicine Residency Training Program of ETSU's Quillen College of Medicine, and he's not only been talking to us about the need for more emphasis on primary care and high-value primary care, but he's been talking to us about various incentives and inspirations for more people to go into it. You have told us many different ways of how going into primary care can reduce costs in countless ways. Just in the few examples you've given us, we have seen where we could have saved a lot of money if these people had better primary care. As I mentioned at the beginning of the show, there have been several studies, and you're probably aware of this, that show in rural areas like Appalachia, the life expectancy is actually lower than the national average. And I think that the studies have shown it is not environmental factors. It is just simple life choices on the part of these people. In some cases, probably caused by a lack of money, but this is really, really good stuff. Any closing thoughts that you would like to give us as we wrap up this program, Dr. Reddy?
More money per person is spent in the United States than any other nation when it comes to healthcare. Yet we have one of the worst health outcomes when compared to other industrialized nations. U.S. spent 16% of its GDP on healthcare in 2007, but ranked 28th in infant mortality. A recent study from Robert Graham Center, states if every American made use of primary care, the healthcare system would see $67 billion in savings annually.
That's a lot.
Yeah, and study after study, and particularly the work of Dr. Barbara Starfield, has shown that healthcare systems that have better health outcomes at a lower cost have more than 50% of their physicians in the primary care force. In the U.S., primary care physicians account less than 30%, and family physicians equate only to 12%. Now, the U.S. healthcare system, which is already strained, will face an influx of patients in 2014, when more than 30 million Americans will have health insurance for the first time. It's really important for us to have adequate primary care force to support that system. If not, where will they go? You have all these patients, but we don't have primary care physicians.
Right.
And at the end, I would like to say this is not a Republican issue. This is not a Democratic issue. Health transcends all this. Whether you're Republican or Democrat, if you have bad health, you will die prematurely.
You won't be able to vote either way.
No, no, you won't. But at the same time, I would like to say, for the American eagle to soar high, we need a right wing and a left wing.
That's great.
So
we need to have more people putting it that way. I like that. Was that your idea?
Yes, sir.
I like that. Someone may be quoting you in the future. The great Dr. Reddy once said. Dr. Trishul Reddy, medical doctor here from ETSU's Quillen College of Medicine. And I really want to thank you for coming this morning.
Thank you so much, Jim, for having me here.